Hey everyone, welcome back. It's 2021. We took a couple weeks off for Fun Fact Friday with Christmas and New Year's being on Friday. So welcome back. We are back with another Fun Fact Friday. And I thought with February just around the corner, and as most of you know, that is our dental month where we celebrate dental disease, we clean all of the teeth, and do all of those things. I thought we would go with a little bit more about cats because they get missed quite a bit. And cats get a specific dental problem called feline oral resorptive lesions, which was really just a fancy name for a cavity in a cat. And so what happens with our cats is actually the dentin, so that outer layer of the tooth starts to get dissolved and starts to erode over time. This, as it starts to erode, gets deeper and deeper into the tooth and can lead to nerve exposure. The biggest problem with that is that causes pain. When the nerve, that tooth nerve is exposed, that's uncomfortable and painful in our kitties. And I know that can affect their appetite. It can affect their ability to groom themselves. It can affect so many different parts of their lives. We don't really know specifically why these happen. We don't see them really in dogs occasionally, but it's pretty rare. A lot of different theories have to do with diet and do we have too much of certain minerals in their diet? Also, we wonder if it has to do with the fact that there are true carnivores. So they eat a mostly meat diet versus an omnivorous diet like our dogs do and things like that. So is this dietary that leads them to have this erosion? Well, we haven't been able to have a causative reason just yet. So why is this so important? Again, we talked about it being pain. This is super common in our cats. 20 to 60% of cats over the age of 5 have had at least one resorptive lesion, or cavity. So we do see it quite often. A lot of the reasons we place cats under anesthesia for dental cleaning is to specifically take care of these resorptive lesions. So how will you know? What will you see? You may see, the extreme is that you're seeing that they're not eating at all and weight loss, but it can be more mild, excessive drooling, dropping food when they go to eat it, food that falls out one side or that they're selectively choosing one side over the other. A cat that may preferentially choose to eat wet food over dry food, and they're staying away from the dry food. And then, of course, the extremes of decreased appetite completely. You may also see if your cat is one that opens its mouth for you or smiles or in a way that you can see the teeth. You may actually even see a red spot or what almost looks like gum tissue, but up onto the tooth. And that's that nerve that's now exposed, that inner dental tissue that's now being exposed. Unfortunately, the only treatment for these is extraction. There's not really any way to repair that loss of dentin because by the time we see them, we're often losing large portions of that tooth. So that is the only treatment. But surprisingly, because these are painful to begin with, removal, they actually are in less pain and feel better after we've removed this painful sore tooth. And our cats do great without these teeth, surprisingly. They eat normally. Most of them gain weight and eat better than they were before because, again, we've removed the source of their discomfort, the reason why they may have had a reduction in eating in the first place. So don't be afraid of extractions. I know it sounds extreme and something we shy away from, but actually these guys do great when we pull these teeth. So I hope this gave you guys a little insight into cats and dental disease. Again, our dental month starts in February, but we book up quickly. So if it's something you're thinking about considering or that you do every year, getting in sooner rather than later is super important. We do have a discount that we run with that. So getting in now so you can get your blood work in advance of dental month in February is going to be super important for those of you looking to do that. Give this video a like and a share. Give me some ideas down below. I always want to talk about what you want to hear about and want to know what you want to hear me talk about it next. Exotics, breed specific things again. We did that a little bit last year and the year before where we pick a breed and talk a little bit about some of the specific things that those dogs or cat breeds get. Let me know. Let me know what you want to hear about, and I'll see you guys next week.